I'm going to demonstrate on how to insert a Foley catheter. In this situation, we bladder scan the patient. They have 700 milliliters of urine, and the doctor ordered a Foley catheter. So I'm going to come in, I'm going to look at the doctor's orders. It says Foley Cath, and I'm going to check my patient's name band to the chart. Cheryl Healy 11032, Cheryl Healy 11032. So I verified the patient. Then I'm going to expose the patient. Having them frog leg helps with the insertion of, this patient can frog leg really well, so this will help with just access to the urethra. Then I'm going to open my sterile package. I'm going to use this bag as a garbage can, and I'm going to place it right here. When you're opening a sterile package, you first want to open away from you, then to the sides, lastly towards yourself. Then I'm going to lay down this sterile covering. The shiny side goes down to the bottom, and oftentimes people don't use this covering, but we're going to, just to extend my sterile field. Then I'm going to don sterile gloves. And you want to remember when you're putting on sterile gloves to step away from the area that you're working and keep your hands above your waist. There are many different ways to do this. The way that I do this is I take my box, I drop it here, and then I take this box and drop it here. The next step is you want to check to make sure the balloon the Foley catheter will be inflated and can inflate correctly. So I'm going to hook up my syringe. And check to make sure the catheter can inflate, which it can. And it's not necessary to disconnect the catheter or the syringe from the catheter, but you do want to make sure all the fluid is out before insertion, making sure that the tube itself is contained in the sterile container. Next, I'm going to squeeze out my lube and apply betadine to my cotton swabs. My left hand is going to be my dirty hand, and I'm going to spread the labia so that I have better access to the urethra. I'm going to take my first cotton swab and start furthest away from me and wipe down front to back. Next one, furthest to me on the labia, down front to back. Last one, in the middle, down front to back. After the cleaning, you're going to grab the catheter and kind of thread it in your hands. Then you're going to insert the catheter into the lube. You want to get it lubed up really well. And then you're going to ask the patient to take a deep breath and bear down and begin the insertion of the catheter, making sure that your right hand does not touch the labia or the vagina, contaminating the sterile field. As soon as I see urine, which I do, I'm going to go 2 inches further. And as soon as I do that, I can stabilize with my left hand and then insert the solution, the 10 ml solution, into the bladder. As soon as I've done that, it's secure in the bladder, and I can release the syringe. And then in most catheter kits, now the sterile part of this procedure is over. In most catheter kits, you will have a contraption that you can hook up this part of the catheter to the leg to make sure that it doesn't pull or disconnect. And then you want to thread this down, make a loop on the bed, and hang the bag on the bed frame, making sure that you don't put it on a side rail.